Hello and welcome to the Vital Signs training created for the Hamel Fire Department and its partners. This training was made for all members to watch and to learn the basics about vital signs. The objectives for this training are to teach what vital signs are, what the normal vital sign ranges are for all patients, to learn what vital signs tell the responder, and how to obtain such vital signs. Along with vital signs, this training will also cover what a sample history is and what the acronym stands for. We will also go over what questions to ask your patient using the OPQRST method. What vital signs are we looking to obtain on scene as first responders? We as first responders need to attempt to obtain rate and quality of respirations, rate and quality of a patient's pulse, the color, temperature, condition, and capillary refill based on skin, the size and reaction to light of a patient's pupils, their blood pressure, and pulse oximetry. For respirations, you will see what the normal ranges are for different age groups in the chart displayed. As you can see that children and pediatric patients tend to have a higher rate of respirations compared to the adult patients. If you take a second and listen to your own breathing, you will hear that you are probably breathing at what first responders would call normal. When talking about the quality of breathing, there are different ways to describe respirations. We use the term shallow breathing when we notice patients are having inadequate chest rise, or in children, we can see abdominal wall expansion. This is also known as seesaw breathing. Labored breathing is when a patient is visually struggling to breathe and using accessory muscles. Occasionally, we will hear different noises along with a patient's breathing. Snoring tells us that there is an obstruction of the upper airway at the pharynx, which is normally the tongue. Wheezing tells us that the bronchioles are constricting. Gurgling is a sound we would hear if there is fluid in the upper airway. Crowing or stridor is a high-pitched noise we hear when there is an obstruction of the upper airway at the larynx.